Today, we are diving into the fascinating yet critical topic of syphilis, a complex and historically significant sexually transmitted infection. Welcome, students, to this exploration of its causes, stages, symptoms, and complications. As we resolve the science behind Treponema pallidum, the bacterium responsible for syphilis, we'll also discuss its laboratory diagnosis, treatment, and the importance of prevention. This journey will provide valuable insights into one of the most intriguing infections in medical history. Let's begin.
Treponema are spiral organism. They are not stained by Gram stain. They are anaerobic. They have a cell wall similar to Gram-negative bacteria. All the spirochates motile without flagella. Treponema is motile by axial filament. Cannot be cultivated on artificial media. They have endoflagella that responsible for rotatory and flexuous movement. The pathogenic Treponema nickel strain cannot be cultured on artificial media and can be propagated by inoculation of specimens into the testis of rabbit. Non-pathogenic Treponema Reiter strain can be cultured anaerobically in vitro. It can be cultured on fluid containing serum or blood. Modes of transmission. They are transmitted from direct sexual contact, or from mother to fetus. Blood transfusion with fresh blood. Stages of syphilis. The primary hard chancre. Secondary syphilis. Tertiary stage. Stages of syphilis. Chancre primary syphilis. 1. The primary hard chancre lesion is hard, painless, superficial ulceration is seen in genital areas and regional lymph nodes are enlarged. The chancre will heal spontaneously from 4 to 6 weeks. Secondary syphilis. It develops 2 to 10 weeks later. The lesions consisting of skin rash, mucus patches, and condylomata, wart-like lesion on anogenital region. T. Pallidum is found in large numbers in the lesions of both stages and highly infectious. 3. Tertiary stage. In about 30% of cases, the secondary stage progresses after months or years into granuloma lesion in the skin, bone, and internal organ gummas. The most common gummas appear in CNS and CVS. Extragenital manifestation of syphilis. Oral chancre. Elevated ulcerated nodules on the lips. Intraoral chancre on the tongue or tonsils. It is heavily populated with treponema, and it represents a considerable danger to the dentist. Microscopical examination of a sample form oral chancre can be confusing because non-pathogenic treponema are present in the mouth. During the secondary stage, it appears as ulcerative mucus patches on lips, tongue, and tonsils called snail track ulcers, which is multiple ulcers crawling over the area. Highly infect oral gumma. Areas of leukoplakia on tongue. Gumma infiltration lead to atrophy of the tongue and hard palate. It is precancerous lesion. Tive stage, which numerous spirosheets are present. Congenital syphilis. A pregnant syphilitic woman can transmit T. pallidum to the fetus through the placenta in week 10 to week 15 of gestation. Fate of the syphilis in pregnant woman. The infected fetus may die, or the pregnancy end by abortion or stillbirth, or the living baby who will develop congenital syphilis in childhood. Signs of congenital syphilis in childhood. Delayed dentition. Enamel hypoplasia that lead to abnormal development of 2 groups of permanent. Upper central incisors appear widely separated and notched. Hutchinson's teeth. First molar show defective cusps and pinched appearance. The dental abnormalities, together with keratitis, lead to blindness. 8. Cranial nerve affection lead to deafness. Saddlebridge nose. Laboratory diagnosis of syphilis. Non-specific antibodies, reagent that react with cardiolipin antigen, extracted from beef heart. Specific antibodies that react with living motile treponema, or fixed treponema antigen. Laboratory identification of Treponema pallidum in acute and secondary stage. Detection of spirochetes in the specimens taken from the chancre in primary stages, or from the skin eruptions and mucus patches in secondary stages, and examined by dark ground microscopy. Treponema appear shiny in narrow coils. Direct smear stained with Fontana stain. Direct immunofluorescence test by detection of antibodies that react with virulent Treponema strains. This test is highly specific and is called the fluorescent treponemal antibody test.
In tertiary stage detection by serological diagnosis. A. Non-treponemal antigen tests. Using nonspecific antigen cardiolipin, which is an alcoholic extract of beef heart muscle, in the form of 1. Venereal Disease Research Laboratory test, VDRL. 2. Rapid Plasma Regain test. 3. Wassermann test, less widely used than VDRL test. While in treponemal specific tests we use fluorescent treponemal antibody absorption test. It is an indirect immunofluorescence test in which the pathogenic treponema nickel strain GA1 patient's serum, GA1 fluorescein, labeled anti-human gamma globulin, is fixed to a slide. After incubation for some time, fluorescence is seen with positive sera. VDRL tests are slide microflocculation tests, non-treponemal tests that detect antibodies produced against cardiolipin antigens and syphilis. Components of test. It uses cardiolipin antigen YA1 antibodies in patient serum. Mix well. Clumps or flocculation occurs which are read using a microscope by low-power lens, indicate positive specimen. Rapid Plasma Regen Test, RP-RI. Components of test. Patientserum, VDRL antigen, cardiolipin antigen with carbon particles or dye. It is used for detection of anticardiolipin antibodies. Reagen, the reaction read by naked eye, and no-need microscope. Requirements for complement fixation test. Serum sample of the patient. Antigen, in case of chronic gonorrhea, the antigen extracted from gonococci. In case of syphilis, the antigen is cardiolipin. Indicator system, sheep RBCs GA1, anti-sheep RBCs. Complement. Complement fixation test is used in the diagnosis of many diseases. Syphilis, chronic gonorrhea, viral infection, fungal infection. We use tube complement fixation test or micro-L complement fixation test. It is used for screening diagnosis of syphilis. No hemolysis mean positive reaction. Hemolysis means a negative reaction. In negative syphilitic case, when patient's serum does not contain antibodies, the complement will not be available to fix to antigen antibodies. Result: complement hemolyse the antibody-coated red blood cells or indicator, synthesize sheep and anti-sheep red blood cells. In syphilitic infection, when patient's serum contain antibodies, the complement will fix to antigen antibodies. Result: complement cannot cause hemolysis of antibody-coated red blood cells. It is used for screening diagnosis of syphilis. No hemolysis mean positive reaction. Hemolysis means a negative reaction.
Prevention and treatment of syphilis. Regular sexually transmitted disease screenings and early treatment of infections are crucial to curbing transmission. Avoiding multiple sexual partners and ensuring partners are tested can significantly reduce risk. Pregnant women should undergo syphilis testing to prevent congenital syphilis and ensure timely treatment if infected. Avoid adultery. That concludes our lecture on syphilis. Thank you for joining me in exploring its causes, stages, symptoms, diagnosis, treatment, and prevention. Now, it's time to test your knowledge tree solving the quiz to reinforce what you've learned today. Stay curious, and I look forward to seeing you in the next video. Until then, study well and keep learning. Goodbye.